Hello, my name is Destiny Jones. I'm a nursing student with the University of South Alabama, and today I'll be doing my med administration checkoff. Before we get started, I'm going to scan the room. Okay. And at this time, I would make sure there were little distractions, that my door was closed, I didn't answer the phone, and that I would not have any conversations with any colleagues unless it was important information towards the administration. And now I'm going to perform hand hygiene. Next, I'm going to compare my patient care order form to my MAR, starting with the right patient, Jaguar Jones, date of birth 08/25/1963, 08/25/1963, MR number 4176352, 4176352, allergies to penicillin. Next, we will do right medication, which is morphine sulfate. Right dose is 5 milligrams. Right route is IM. Time every 4 hours. And right indication is PRN for pain. And for documentation, we would say all elements of a legal prescription are present, and everything is copied over correctly onto our patient care order form. So I will put this to the side. And now we'll be just working from the MAR, and I'm going to prepare my medication. Before we do that, I'm going to perform hand hygiene. Next, I'm going to start my first round of 7 rights, starting with the right patient, Jaguar Jones. Now we will be looking for right medication, which is morphine sulfate. I have morphine sulfate. This is 10 milligrams per 1 milliliter. Expiration 12/20/2025. It's not expired. For right dose, we will be giving 5 milligrams. In my vial, I have 10 milligrams per 1 milliliter, which means I will pull up half a milliliter. And if it was indicated, I will ask another nurse to check my calculations. For right route, we're going to do IM. Since we're doing IM, I am going to use a 3 milliliter syringe. And I'm going to use a 23 size needle. Okay. And for time, we're going to do every 4 hours. Mr. Jones has not had his medication yet since the last 4 hours, so we're good to give it to him. And indications PRN for pain. Morphine is a pain medication, and Mr. Jones is complaining of pain. And for right documentation, we would say all elements of a legal prescription are here. So now we'll prepare for our draw up of the medication. I'm gonna first clean the vial. Start with the inner, going out. Taking my 3 milliliter syringe because we're doing our IM route. I'm going to take our blunt cannula. Look it on there. I'm going to pull up half a milliliter of air. Get the half milliliter of air. I wipe my vial. I'm going to stick it in, inject the air in, turn it upside down, draw up half a milliliter, make sure all bubbles are out. Okay. I will double check my calculations. We will be administering 5 milligrams. Well, first let me do the scoop method. I'm going to do the scoop method. Okay. So I will be giving 5 milligrams. There's 10 milligrams in this per milliliter in the vial, which means I will draw half a milliliter. We have our half milliliter in the syringe, which is our 5 milligrams we will be giving. And I would again ask the nurse to recheck my calculation. So now I'm going to prepare a label. While I'm doing this, I am going to do my second round of 7 rights, starting with right patient, Jaguar Jones. We're going to write that on the label. Right medication is morphine sulfate. And our right dose, we have 10 milligrams per 1 milliliter. We're going to administer 5 milligrams. So that means we will pull up half a milliliter, and that's what we have in our syringe, is the half a milliliter. And I'll write that 5 milligram dosage on our label. And I'm going to take the label and I'm going to wrap it around the needle, the syringe, I'm sorry. All right. And for right route, we're going to go IM. That's why we chose this 3 milliliter syringe with our 23 size needle. For right time, every 4 hours. Mr. Jones has not had his medication yet, so we're good to give it to him. For indication, PRN for pain. Morphine is a pain medication, and Mr. Jones is complaining of pain. And for right documentation, all elements of a legal prescription are present. So now what we'll do is we would head to the patient room. Before we head in there, I'm going to change our blunt cannula and put in our needle. Okay, so I would take the syringe, the vial, and the MAR, and I would head out to go to the patient's room. Okay, I am in the patient's room. I'm going to perform hand hygiene. I'm going to go ahead and put on my goggles and my gloves. And I would tell Mr. Jones, well, first I would identify my 2 patient identifiers. So we have Jaguar Jones, date of birth 08/25/1963, 08/25/1963, MR number 4176352, 4176352. He has an allergy to penicillin. Okay, and while I'm right here, I would say, hey, Mr. Jones, I'm here to give you your pain medication. I see you have an allergy to penicillin. Is there any more allergies I need to know about? He says no, so we will move on. I would take any pre-assessments I need to take, like any vitals, blood pressures, and a pain assessment or respiratory. After that, I'm going to come back here and I'm going to do my 3rd check of my rights, starting with Jaguar Jones, the right patient, right medication, morphine sulfate. The right dose, 5 milligrams. There's 10 milligrams per 1 milliliter in the vial. So that means we'll have half a milliliter. I have that half a milliliter in our syringe. Right route is IM. The right time is every 4 hours. Mr. Jones has not had his medication, so he's good. Right indication is PRN for pain. Morphine is a pain medication, so we will give it to Mr. Jones because he's complaining of pain. And all elements of a legal prescription are present. So now we'll go back to Mr. Jones, and I will describe to him what we're about to do. Mr. Jones, I'm about to give you your pain medication. And what I would do is lower his bed. I would lower his bed. No, I would raise his bed to a working height and lower his side rails. We're going to give the injection IM. I'm going to first make sure the skin integrity is good. Make sure there are no bruises. I'm going to take another alcohol pad. We're going to do this ventrogluteal. Starting with the inside, wiping out, not going over any spots. I would pull on the skin, going in at a 90-degree angle. Okay, you ready, Mr. Jones? 1, 2, 3. I'm going to aspirate for any blood. I don't see any blood, so we're going to shoot it on in. Taking my alcohol wipe, I'm going to pull it out. Dispose of this. Without massaging, we're just going to apply gentle pressure. Okay, and now I would watch to see Mr. Jones's reaction. And when I've done that, I'm going to come back to my little working area, and I'm going to document my procedure. And I'm going to document how Mr. Jones tolerated and if he had any reaction to the medication. Then I would throw away all of my things. I'm going to take gloves off, glove to glove, skin to skin, throw those away. And then I'm going to perform hand hygiene again. Before I leave the room, I will make sure the bed was back to a comfortable height. Lowest position, I'm going to raise the side rails and make sure the patient's comfortable. Then I'm going to just perform hand hygiene again. Then I would leave and I would return back to the room 30 minutes later to see if he had any reaction, how he's doing off the medication, and document that again. And now I am done with my medication administration.